Hi, everybody, and welcome to today's webinar session. We're going to go ahead and get started. My name is Samantha Palmieri, and I'm on the marketing team here at Collective Health. I'll be taking the next few minutes to kick us off for today's webinar, and then I'll hand it over to our host, Dr. Rajay Batniji, and guests from Lyra Health and Cleo. I'd like to start by thanking you all for joining us today. Just like you, we're feeling the weight of social distancing due to COVID-19. Grief, stress, and anxiety are all completely normal feelings to have as we continue to navigate through increasing uncertainty. Our hope today is to bring together a couple companies who are helping people manage these feelings head on with solutions supporting behavioral health in addition to families whose daily lives have been turned upside down. Before I introduce us to our speakers, I'd like to flag a number of resources, including our COVID-19 Online Resource Center. This resource center includes several features and tools and links to a number of resources provided by our partners, such as Lyra and Cleo. You can find more information on these by visiting the links shown on the bottom left-hand portion of the screen. And with that, I'd like to kick off by introducing you to our moderator today, Dr. Rajay Batniji. Rajay is Collective Health's co-founder and chief health officer, as well as a physician and political economist. He previously served as a clinical assistant professor of medicine at Stanford for 6 years. At Collective Health, he oversees analytics, as well as our clinical and population health programs. And, fun fact, he received his PhD in political science focused on global disease control efforts. So he's certainly putting his efforts to good use. Without further ado, Rajay, why don't you go ahead and take it from here?
Great, thank you. I know everyone that's joining us today, along with your entire team's been focused on the COVID response. One of the things that we've heard is there's sort of two elements to the response that everyone's thinking about. The first is, how do I make sure that people that are affected directly are getting excellent care, have access to testing, have all the right resources to know whether or not they need to get care, as well as the ability to actually get care in a place that they can do so. And that's a small percentage, a fraction of a percentage of each of your populations. But something that impacts absolutely everybody is the behavioral health effects of this crisis, the behavioral health effects of the isolation related to it, the additional burden that it's placed, especially on parents who are trying to work full time while also taking care of their kids at home, something that I think many of you and your teams have been dealing with directly. And so the purpose of today's discussion is really to focus on those two elements. We've heard those in our client advisory group and with multiple discussions that we've had as two of the key areas that I think everyone's thinking about strategies for and really trying to get out of the box and think beyond what they've typically done for addressing the needs of their population. So I'm really excited that I can be joined today by two very wonderful people, both physicians, both leaders in their respective domains. Dr. Connie Chen is the Chief Medical Officer at Lyra Health. She's also an internal medicine physician at UCSF. Connie and I go back to our residency days where we trained together. So wonderful to be on with you, Connie. And from Cleo, Dr. Chitra Akileswaran, who's the co-founder and chief medical officer at Cleo. She's a obstetrician gynecologist, and she's practicing medicine today at a large county health system in Oakland, California. And last time as we were preparing, Chitra was actually in the hospital and in scrubs. So I'm glad that you're out of the front lines today to join this discussion and share your wisdom. So no further ado, want to hand it to both of you, and maybe just for everybody who's not familiar with what you and your organizations do, maybe you could tell us a little bit about what Lyra and Cleo do, and how do you support employees and companies? Connie, do you want to start us off?
Sure. Maybe I'll just start with what Lyra does, and so I don't go on for too long. I'll tell you a little bit about what we're doing for COVID-19 in a little bit. But so Lyra is a comprehensive mental health benefit. We work with a lot of employers and offer mental health coaching, psychotherapy, and psychiatric medication management. And it's either structured as an EAP or an integration through your health plan. And one of our core differentiations is that we really emphasize fast, timely access to high quality evidence-based care. And I think what we've seen over the last 5 years is that 80% of clients in treatment with Lyra achieve clinically significant improvement, which is just really incredible. Today, we're available to about 1.2 million members across all 50 states and work with amazing employers like Starbucks, Facebook, and Genentech.
I think I can take it from there.
Please do, Chitra.
Yeah, so what Cleo does is we are a digital family support system that supports the entirety of the parenting journey from preconception through up to when children are 5 years old. Our flagship product is really around the sort of kind of pregnancy and postpartum period. So we support parents from the expecting phase through the first year of baby's life, and that's sort of where we started. And our care model, the cornerstone of our care model, is really around providing sort of digitally based human support, where every family is sort of assigned what we call a Cleo guide. That guide is sort of appropriately expertise in an area that is significant to the period in which you're in. So if you are in the preconception period, that person might be a nurse that specializes in fertility. If you're in the pregnancy and postpartum period, that might be a doula. And if you're in the sort of early parenthood period, that might be a developmental counselor or parent coach. And that is a person that is with you through that entire journey. So it's sort of your person and is often providing you personalized evidence-based guidance that you can't get through your doctor's office or have a really hard time sorting out on the internet or through friends. So what we're here to do is sort of provide that signal through the noise and really get you the information that you need to make the best decisions for you, given that growing a family is a time where you're making lots and lots and lots and lots of decisions that are usually very, very personal to you. We work with very large employers. We work globally. We have guides that are actually based in, I believe, over 40 countries at this point, and provide support in a lot of different languages. So we're really able to transcend some of the cross-cultural aspects of growing a family and being a parent, and really, really proud of that. So I will leave it there, and we can talk a little bit more about the COVID-19 response on our end as well.
Thanks, Chitra. And I know you won't hold it against me if my 2-year-old's banging at he's banging at the door trying to get in. So
It should be a theme.
Seems to be a theme. I think, we've seen every company transition what they do, or in some cases completely transform their companies to respond to this crisis. I mean, it's actually totally unprecedented. I don't think anyone can think of a, modern historical event that's actually even come close in terms of fundamentally changing all of us. But, I wonder from your vantage point, how have you changed your company, your product, especially in response to COVID-19? Chitra, you want to start us off on this one?
Sure. Starting a family, growing a family, and trying to figure out all the sort of aspects of that is already incredibly fraught with uncertainty and with, like I said, a lot of decision making. And then add on sort of COVID-19 on top of that. And there are a lot of aspects of the parenting journey that are being directly impacted by the pandemic, whether that is fertility treatments being suspended, whether that's prenatal care being moved virtually where it never had been before, whether that's not being allowed to support person in labor, or having a very curtailed postpartum stay and really not getting the skills to be able to breastfeed in the hospital, and then not even having the ability to bring support people to you, whether that's family that can't travel or whatnot. And then, of course, being a working parent with young children like you're experiencing right now, and having to be the teacher, the caregiver, the household manager, in addition to being a working employee, is all sort of part of what we're seeing, kind of the needs arising during this time for the members that we're supporting. So some of the things that we're doing sort of in response to this is, of course, doing a lot of listening around what our members are needing, but there's a couple sort of specific tangible efforts that we're making to address those needs. One is, as many companies are doing, Collective Health and Lyra included, sort of building a really robust content that's being provided actually directly to the public on our COVID-19 support page. And that's not just something that we are throwing up a blog post once a week around, but it's actually something we're actively updating, I would imagine even hourly, with content that's written, videos, and as well as a very sort of hefty series of live webinars and group discussions that are really focused on, again, that sort of entirety of the parenting journey. So that's sort of one thing, and I would certainly encourage anyone on this webinar to share that Cleo Live series with their employees, since it is sort of available to the general public. The second thing is really around allowing employers to sort of quick start with Cleo in a way that may not require the level of commitment that we typically would expect from new customers. So if you're interested in providing Cleo to your employees as a benefit, I know the benefits landscape is very much sort of being kind of reworked at this time, just given the shifting of needs, that we do have a product that is sort of a more kind of tailored product to this time period that you can sort of get started with your employees. So those are some of the things, but also just because our guides are sort of situated in so many countries where families are experiencing the pandemic in very different stages. We have obviously families in New York City, we have families in Europe, we have families in Asia that are being impacted in different ways. We're also sort of trying to also keep as sort of ahead of the curve on what is the latest evidence on how we can support parents and families during this time. How do you, we just had a blog post last week on masking based on the CDC guidelines that we're just about to change to universal masking. And the content of that is not just around whether to mask or not, but actually how do you talk to your children about it? So it's very, very tailored to sort of this audience around, you're a working family, you're a working parent. How do you actually sort of digest the information that's coming out through the government and CDC and sort of all the various agencies and really tailor it to your personal home situation? I'll stop there.
That's super helpful. I mean, I could tell you our toddler, and my wife and I are both doctors, is constantly talking about the virus and asking questions about it. And, we're two physicians and I don't feel totally prepared about how much detail to share, what I should be telling him, how I should be explaining this, because I think we're all at a loss there. So would love to learn more about that. And are there any online resources, Chitra, that you would sort of point us to, or anything that's out there that can be helpful?
Yeah. So I think in general, sort of around pregnancy itself, I think the American College of Congress, of Obstetrics and Gynecology typically has the latest guidelines, and actually they are producing a lot more patient-facing material. But even if you were to read or be a bit aware of sort of the provider guidelines, that would be something that is helpful, because there's a lot that's happening around pregnancy and birth that is really, really scary and confusing for families around, again, support people, whether you're going to be offered an induction, kind of what you're going to be expected to do while you're in the hospital, etc. I think also on the children front, there's a great organization called 0to3.org, which is a nonprofit organization that provides really helpful sort of developmentally appropriate conversation guides and resources that can be just useful to peruse. And I'm not saying that you need to go out and sort of like consume a bunch of content right now, but I'm saying just in your back pocket, in case you sort of you learn something on the news and kind of want to check and see whether these organizations have responded with anything that's specific to your role as a parent. I think that can be helpful.
That's super helpful. Thanks, Chitra. Connie, would love to learn more about what Lyra is doing in response to the crisis, and any new products that you've created, or how you're bringing together resources for people.
Yeah, it's a great question. So I think our response to the crisis has really fallen in two buckets. It's what we're doing to support employers more broadly, and then what we're doing to support your members who have really acute needs at the moment. So in terms of employers like Collective and Cleo, we've launched a publicly available resource with guides, handouts, and videos that employers can use with their employees to provide general education. We've been doing a lot of intensive handholding with our HR and benefits leaders around a lot of manager consults, a lot of clinical consulting around their mental health strategy, and as we're moving into a different phase of the pandemic, this is a bit unfortunate, we've launched, virtual video-based critical incident support groups as companies are encountering some of their first coronavirus deaths. On the employer side, I'd say you could sort of put members in two categories. There were people who had existing mental health issues, and for folks who had an existing history of trauma or anxiety or depression, this is a really hard time for them. But even for people who did not have pre-existing mental illness, we're just seeing a surge of distress that's really broad-based. So initially, in the first couple of weeks, it was really anxiety symptoms that were spiking. So as people were coming to care, we were noticing that baseline anxiety symptomatology was just significantly higher than it usually is. And now that social distancing has been in place for about 3 weeks, people are really isolated in their homes. They're not able to activate and, connect with others. And we're now seeing depressive symptoms really rise in our population. So what we've really tried to do, we've activated 100% of our provider network for video. So as of a month ago, I'd say about 35% of our visits were by video. It's now almost 100%, as you might imagine. And, people are able to leverage coaching for people who are really acutely stressed, evidence-based therapy for those who have more significant psychopathology. And then we're also getting an influx of members who are unable to get a mental health prescription, whether it's a new prescription or refill, who are using our video-based medication management services. And then for the highest risk groups, we're seeing just really high utilization of our care navigation services. So there's just been a high rates of crises, suicidality, worsening substance use disorder, domestic violence, CPS reports. So, it's really a broad set of things, but we're really trying to help different parts of the member base with very different needs.
That makes a ton of sense. And Connie, curious from your vantage point, for people that either want more information that aren't currently our customers, is there anything that you would point them to as a good resource for how to think about their behavioral health strategy, either content you've created or something else out there as a reference?
Yeah, so I think Samantha had listed the website of our coronavirus resource center that we've been updating every day. There are a lot of great resources there. The American Psychological Association, the APA, also has a great resource center that they launched, I think, a week ago, that has some really great resources that are a really great starting point. I think for a lot of people, even just self-care, so access to things that they can interact with themselves is something, though. I think companies should recognize that there is a large population that has more severe symptoms right now.
Mm-hmm. Super helpful. I think one of the questions that I have for both of you, and something we observe here at Collective Health, is some changes in what our members are getting in touch with us about. I think initially we thought everyone was going to be calling to ask us about how to access testing for coronavirus and how to potentially find care. And in fact, actually, most of our inquiry increase is related to deferred care, for routine conditions, people with a chronic disease or a serious condition, like calling to figure out how to get infusions now and transferring infusions that previously were done in a facility to home. And so in many ways, maybe not what everyone expected the calls to be about. I'm curious, sort of what's emerging in terms of what you're seeing your members reach out to you about. I know, Connie, maybe for you, there's a ton in the media about actually for both of you, there's a ton in the media on the burden on parents. Maybe I just fixate to that because it's like I have a constant reminder of it. But I'm curious how you kind of see that trend playing out in your members. And there's also been a ton in the media, Chitra, on the impact of parents being asked, their mothers being asked to labor alone. Curious, what impact you're seeing there, and actually kind of what are the biggest concerns that people are calling you about, either peripartum or for those young parents.
Yeah, I'm happy to start, and I think it will build on a lot of what Connie was talking about in terms of kind of these inquiries and inbound messages really falling into a few different buckets. We've seen a huge surge in sort of the amount of support that our members are asking for, and that's something that we are really not only well positioned to be able to handle, just in terms of the fact that we have sort of been virtual for a very long time now, but also really feel prepared in terms of the kind of voice that we typically have, which is one of very science-based, very evidence-based, but also very personal to you. So in a way, this is like the perfect opportunity to really allow what Cleo's model is to shine. But the messages and the sort of inbound that we're getting and the engagement that we're getting, which has always been very high, but is even higher now, is really around managing a lot of uncertainty around care. And that kind of falls into two flavors in our realm. One is in the face of the fact that health systems and communities are really trying to solve for sort of majority health, sort of what is best for the majority. So maybe it is best that, theoretically, it might be best that no one that is unnecessary to a healthcare setting comes into that healthcare setting. But if that is the case, then for your specific family and for your specific experience, it's still your experience. And how do you know when to push back? And how do you know how to ask for what might be best for you? So in the case of what was happening in New York City around partner bans in labor, that spurred a lot of discussion amongst our members around, is this something that I can expect from my birth? I'm, now 37 weeks. I'm going to be having a baby very soon. Should I be switching hospitals? What do I need to do to engage my hospital? There was a lot of concern about that and anticipation that, we don't know what's going to happen. How do we sort of handle this in the face of this uncertainty? I think what we've been really able to do is, number one, sort of contextualize these policies because we have such a vantage point around what's happening nationally as well as internationally. Is this something that is really a trend that's going to take hold? And what we see is that, in fact, many hospitals are really are sticking to sort of, yes, support in labor is important. We will continue to support that. This what happened in New York City was really specific to a very uncertain time in New York City that has now been reversed. And of course, New York City is dealing with the worst of what's happening right now. But we are able to sort of help guide families towards the conversations that they need to be having so that they still feel like they're not just a number, that they are sort of being able to make decisions that are right for them, and being honest about what their limitations are. So that's sort of one sort of flavor, is sort of how do I continue to maintain individuality and sort of my preferences in the face of what is happening around me, particularly around pregnancy and birth and postpartum. That's so important because building a family is incredibly personal. I think the second theme is really around more of the same of what we typically saw, which is that I still need help around breastfeeding. I still need help around sleep training, and I still need help around managing work and home, and all the things that we would normally handle is sort of at an increased volume because the resources that were originally there are really not there. So, pediatricians are less available, but for immunization appointments, most appointments are being held virtually or being deferred. The same thing goes for a lot of the support that was happening in the community around lactation or around sleep or child development. Those are all sort of being deferred. A lot of the prenatal care is, again, occurring virtually or being spaced out. And so all the sort of typical questions and concerns, even on the low risk pregnancy side, but also on the high risk pregnancy side where, people are experiencing chronic conditions, are really not able to access the level of care that they used to, are sort of coming to us as well. So I think it very much follows what you all have been saying.
Thanks, Chitra. Connie, I'm curious, kind of what are the trends you're seeing in member inbound inquiries to you, or anything that surprised you?
So interestingly enough, about a week and a half ago, we did do a survey of our therapists because we wanted to get a sense of, was there a shift in what clients were presenting with, and what could we do in terms of accelerating the development of teaching resources, content materials for our providers. And, just to echo what Chitra said, the number one concern was, concerns around just the balancing work and parenting at home, the difficulty of working at home, and just fears around family members getting sick. People were not so much scared about getting sick themselves, but it was just the sort of like inability to regulate their worrying about like others that they loved and cared about. In terms of psychological issues, it was fascinating to us, which was that 86% of the therapists said that one of the top issues amongst their clients was excessively following media. So the 24/7 media cycle is really creating a lot of distress amongst a lot of members, inability to stop and sort of balance, like, what does this mean for me? 86% also said that their clients are feeling really overwhelmed, and they're doing a lot of what we call catastrophizing, right? So it's really, there is something that you should worry about, but that worry is spinning out of control in terms of the magnitude and the perceived impact on you and your family. And the good thing, I think, is that the interventions for these things are a lot of the core psychological interventions that work, whether it's a pandemic or not a pandemic, right? So some of the things that our providers have been working with clients on that have been particularly effective is just validating people's feelings, right? The fact that you're freaking out and anxious and stressed and depressed, that is pretty common right now. And I don't think there needs to be any shame associated with that. We're doing a lot of cognitive restructuring with clients, really, helping them put language to kind of the spiraling feelings, the catastrophizing, the black and white thinking, helping them recognize that and change their thoughts. And, two of my favorite skills, which have been personally really helpful for me, which is, how do you deal with worry, right? So what is productive worry? What is unproductive worry? Can you schedule time during the day to have dedicated worrying time and then sort of be a little bit liberated the rest of the time? Things like radical acceptance, it's no one's fault that we're in this pandemic, and honestly, there's just not much we can do other than accept the situation and try to sort of live our lives as we can. So I think the good news is that, clients are, once they engage in care, they're doing well. But there is just a lot of fear and worry that has really been accelerated and accentuated by the crisis that is scary for a lot of people.
We understand that. I'm wondering, in terms of, well, actually, before I go into the next discussion point, just wanted to ask, actually, I know that we're about halfway or a little over halfway through our time, and we do want to make sure we allow time for audience questions. So please do share your questions, and we will get to those in a few minutes. So keep them coming. You should be able to do that through the Zoom function on Q&A. I'm curious to hear, what advice would you give to employers right now? I mean, I think I talked to dozens of employers in the last couple of weeks, and, literally, I think people that run benefits have gone from maybe presenting to their C-suite, once a year to now every day. And a lot more demand is being placed on the leaders that are responsible for the health of their employees, more than ever before. Curious, kind of as you talk to benefits leaders and HR leaders, in many cases, kind of C-suite execs, what advice do you give them about how to think about their own population health and what they could be offering their people?
I think we're all sort of going through this with our own companies as well. So I think part of it is sort of an internal reflection around what we're doing and what we can do for our employees, and also sort of expounding that to the employers that we work with. I think there's some things that I'll speak to specifically on the part of expecting families, because that's sort of a very high risk population, not only because they are extremely vulnerable in terms of the time that they're in, but also because it's a population that is at risk for turnover, voluntarily. I don't know that during this time people really want to be out of a job, but we do know that parents tend to leave the workforce when they have a baby if they don't feel connected to their employers. So I think this is a time when we want to bring people together, when employers still need to be cognizant of the fact that, feeling connected is extraordinarily difficult right now, and to the extent that you can provide that environment is helpful, especially to expecting parents. So there's a couple of things I think I would say specifically for those individuals, and then more generally kind of what we're seeing. So for individuals, for expecting families, which we obviously handle a lot of expecting parents and kind of see them through the process of going on parental leave and transitioning back to work and sort of all the in-betweens of that. I think one of the things that's really relevant at this point is being resurfacing kind of what your health plan benefits are at this point, and especially what facilities are in network.
Chitra, I think we may have lost you for a second there, but we can come back to that thought as soon as you're back about finding in-network providers. All right, Connie, you're still there?
Yeah.
All right, good.
On the mental health side, I think you could sort of think about it as what do you do in the immediate term, and what does coronavirus mean sort of more broadly. And I think both are super important, because putting a Band-Aid now is I think not a great idea. So I do think there's a surge in the need for mental health treatment at this moment. And, we've had a lot of inbound interest from employers asking about our services. And I think some of the things that I would encourage employers to really think about is, if you're going to turn something on, really understand, is the provider truly able to guarantee access, right? So it's not, particularly in a moment like this where there's urgency, scheduling, having to wait 6 weeks to schedule your first appointment is not particularly helpful for your employee who is in distress. So one is really thinking about access. The second is quality. I think whether we're in a crisis situation or whether we're not, particularly in the field of mental health, which has really struggled from, heterogeneity in terms of quality, making sure that your employees have access to evidence-based care is really important. And then I think in terms of the short term versus the long term, we've actually seen, in week 1 of shelter in place, I think there was probably a slight dip in the demand for care, and that has been rising week over week. So as people are sort of settling into this new routine and getting out of the immediate crisis of what do I do to take care of my kids and work from home at the same time, we're just seeing a surge in people who really are needing mental health care. And a lot of the researchers who think deeply about mental health believe that this is only the beginning, that we're actually going to see a wave of mental health needs that's just going to grow over the next year as people are somewhat traumatized by what's happening right now. And it's going to take them a little bit of time to have the time bandwidth, but also the courage to seek care, and making sure that you have the right solution in place, not just in this immediate time, but longer term.
Hey, all, sorry.
Hey, welcome back, Chitra.
some of the pitfalls of video. Thank you, Connie. Sorry for having to dip it over to you. Do you mind if I circle back on?
Yeah, please do. Please do.
I was just saying, surfacing that the facilities and services that are in your health plan can be helpful particularly for expecting parents, not only because you may be diverted to another hospital, but because your hospital or health system may be instituting policies that you're uncomfortable with, that you may not be able to honor just based on your own personal preferences, whether that's being compelled to have an induction of labor or only being able to stay in the hospital for a day postpartum. That is not something that's homogenous across all institutions. And so just knowing that would be helpful. I think I'm going to build on what Connie was saying. I think another thing is sort of in health information curation. There's just so much information, and I think people are really afraid of missing something. So to the extent that you can, periodically send out information that is trusted and curated, I think where people don't have to feel like they have to go to 100 different sources, I think can be really helpful. And then the third thing is really just rethinking kind of what benefits are most relevant right this moment, where particularly parents are taking on so many other roles. They're teachers, they're caregivers, they're household managers, in addition to being, employees, and what's the right sort of bundle to again kind of present at this point in time, I think is really valuable.
Mm-hmm. I'm gonna transition to a couple audience questions. We've had several come in now. The first, I think, Connie, this might be more specifically targeted to you and your scope of work. Any thoughts on helping managers recognize signs of employee distress while we're working on a virtual basis? Video interactions can feel impersonal. So how do you advise managers, 1, to recognize those symptoms, and 2, what can they do to support people, and what are the boundaries?
It's a great question. Video, it is hard because the only way managers can know is if that information is shared. So I think in a world of video where you won't like serendipitously, stumble across your employee, in the hallways, it's just so important to check in, as much as you can, whether it's by Slack or through video, and really create space where it's okay to be vulnerable and share. I think, some of the most important things is for your employee to feel like they can express things that are challenging to you and to have a culture where that's okay. But it is hard because if the employee doesn't tell you or doesn't tell someone, you are limited in what you can do. And just in some ways recognition is helpful, just recognizing that employees may be holding things in that may be impacting their performance that they may not be sharing. So if something just feels off, just keeping that in mind, that may be one of the stories of what might be going. You just don't know what's going on at home right
now. Another question that I think is relevant for both of you was asked, are any of the things you're all doing now around supporting families and mental health here to stay? There seem to be some extraordinary measures being taken now, but will they stick? How do we change our mindset to adjust to a new normal? Chitra, what do you think?
I think from the healthcare perspective, yes, there's a lot happening in telehealth, as Connie mentioned. I mean, going from 35 to 100% telehealth is incredible in just a period of weeks, and who knows how many years that would have taken outside of a forcing function like a pandemic. I think that's happening with perinatal care as well. I mean, I think obstetricians, we are the most obstinate of people, and we probably would have had our patients come in and take entire days off from work to do very, very cursory exams and speak to them for 5 minutes, where now we are doing a lot of that care virtually. So I think that's definitely sort of a trend that was accelerated by this pandemic. That's a good thing. On the workforce side, I do think that we're seeing companies are sort of rearranged to be able to accommodate more remote work, more flexible work, and people being able to bring more of themselves to work. I know that's something that has always been a little bit more of a trend in tech, but is happening in other industries as well, where people are a little bit more honest and open about, these are the things I can do this week, and these are the things I'm really not going to be able to do. And I think kind of opening up those conversations is something that hopefully will stick. I don't think that's going to change as a result of kind of going back to an in-person mode of communication. And then I think also just being able to work remotely and connect remotely. I think, Connie, some of the things that you were saying around making space is something that is going to be learned by managers and probably going to be continued. And that's going to serve both in the digital kind of platform, but also in person, which is good. And I think all of these changes, I mean, as difficult as this period is probably are probably things that should have happened and will be here because they are evolutionarily important for us as a society.
Yeah, I couldn't agree more. I think, and Connie, I'd love to hear your thoughts. I think crises like this have a tendency to sort of accelerate the changes that were underway. They don't necessarily, create new changes. So I think we're seeing a huge acceleration to, frankly, probably the lasting future of how healthcare is going to be delivered.
For sure. I think on the mental health side, I think the two changes I'm probably most excited about are, one, somewhat on the stigma side. I think, the employers we work with have always been very sort of embracing of talking about mental health, but sort of obviously the volume of those communications has really increased recently. And I think, coronavirus has also given people an opportunity to seek care who may have felt that, not having an excuse felt maybe they were worried about that. The second is, to Chitra's point, this transition to video, right? So, almost 100% of our sessions are now being done by live video. And we really hope and believe this behavior will stick. The research really shows that video-based mental health care is as robust as in-person care. You get the same clinical outcomes, the same therapeutic alliance. We've seen in our own data at Lyra that sometimes the clinical outcomes data is even stronger. Because the interesting thing about a video-based model is that it allows you to do things that aren't really possible in in-person sessions, right? So if you think about how therapy used to be done is, you'd go see your therapist, maybe they'd hand you a paper worksheet, you wouldn't talk to them at all in between your sessions. But in video-based models, you can integrate things like secure messaging, which we have between providers and clients, so providers can check in and provide ongoing support. You can embed, digital CBT and interactive exercises that allow clients to practice and get better between sessions. So the technology model actually, it's not just about making care more convenient and accessible. You can make care better that way. And we're excited that so many people are open and interested in video-based care right now.
Great. Sam, maybe before we go to the next question, just want to do a time check. How are we doing?
Yeah, great. Thanks for asking. We actually have time for one, maybe two more. But really quickly, I'd actually like to remind everyone we're going to throw up out a survey question right now. You can mark it quickly or move it to the side. But thank you in advance for any feedback you're able to provide. Roger, go ahead and close out Q&A.
Sure. So here we go. The next question is, what different ways of coping are you seeing in people living alone versus people living with family and or others? I think everyone is focused on loneliness and isolation clearly, and curious to hear your thoughts on this front.
Sure, I guess I'll jump in. This is a really hard one. We definitely are seeing that folks who live alone, so a lot of times, maybe younger employees who don't have a partner or family, are having a really hard time. And I'd say the subpopulations that are particularly struggling right now are, anyone who had any, social anxiety beforehand. Think about how much harder it is to combat that when you can't go outside. I think also folks who had any sort of depressive symptoms, being alone and not going outside, it's been really, really challenging. I think our tools are very limited. We encourage people to find virtual channels, whether it is through, Zoom with friends or, playing games together. There are a lot of creative things that people are doing, but I can't say it's a total substitute for actually seeing people in person. Maybe I'm a little bit old school that way.
Yeah, no, that's interesting. And Chitra, maybe the next one's actually, a good question for you, which is, someone asked, I'm getting the sense that people are annoyed with the documents created for tips on working from home, but what is the number one task or activity for expecting families or everyone that's proving helpful to your members today?
That is a really good question. There are an abundance of resources being provided, and it's almost, I wonder if we're solving for the right thing is the question. I think we're trying to make it possible and normal for people to be full-time caregivers and be full-time employees. And to me, that's just not possible. There is a trade-off there. It's going to be, I think, being able to set some boundaries around your time and around your bandwidth is really important. So, I saw one thing that we're really giving our members permission to do is opt out. So when do you opt out of parts of your workday and resume them later at a time when you have more bandwidth? When do you opt out of being a teacher to your child? And then when do you actually resume that activity? And it's okay to not be able to do it all, I think is the big sort of theme here. You don't have to sort of stick to the 8 to 5 workday and an 8 to 3 school day. That's just not going to be possible. So in terms of number one task and activity, I think it's sort of giving yourself permission to say, no, we just can't take this on. We can't do this problem set today. It's just not going to happen. And knowing kind of your children and knowing your family's needs, just being able to draw those boundaries is incredibly helpful.
Maybe I'll just chime in with it, just to echo Chitra's point. We're actually creating a video vignette teaching some skills around this exact thing right now. And one of the key things we've seen is just self-compassion. We see a lot of people are very judgmental against themselves. They are saying, well, my coworker who doesn't have kids is more productive. There's a lot of sort of internal negative dialogue, and just telling people that, this is an extraordinary time. You should forgive yourself, do your best. And make it till tomorrow, you know.
You both made me feel better. No, seriously, thank you. I think, I've been inspired by the way, frankly, everybody has been responding to this, from our customers to, all the leaders in across companies that we work with, really thinking about their people and putting that at the front and center of what they're doing. But then also the whole universe of healthcare technology companies that have changed, quickly adapted, and are really doing their best to be part of the essential response to this. So thank you both, Chitra and Connie, for what you and your teams are doing here. It's incredibly important and totally inspiring.
Awesome. Thanks, guys. We really appreciate it. And thank you again, Roger, and everybody else who joined us today. I'm going to go ahead and pull up our thank you slide. For those of you who actually missed the previous webinars in this series, we'll have a page accessible where you can access. Just a friendly reminder as well to check out the online resources I mentioned at the beginning of today's webinar. You can actually see them right here over on the right side. Other than that, I'd like to thank our partners again for collaborating with us, and we hope you all have a great rest of the week. Thank you so much for joining us. Have a great day.
Thank you.